Okay, so when looking at systems of belonging, especially in the context of healthcare organizations and teams during the COVID-19 pandemic, and the impact that this pandemic had on these systems of belonging, we felt that it was critical then to kind of start with what the current definition then is of radical belonging. And when looking at radical belonging, it's not a very, I would say, obvious obvious term, but Lindo Bacon really looked to dive into this idea, and he defined it as when we have radical belonging, it's helping us then heal from the individual and collective trauma of injustice and support our transition from a culture of othering to one of belonging. So instead of feeling isolation, it becomes then more of a community of inclusion. And when we then looked to define what radical belonging would be ultimately for this commission, we kind of felt that radical belonging was, sure, it is a sense of we're moving away from othering and moving more into belonging, but it's a multifaceted idea where one really feels that they're part of something then that is far greater than just themselves. So this could be in a number of different situations. This could be in one's own life. This could be in one's own house setting or kind of family life. It can be at one's job. So it can apply to a variety of different settings and contexts. But it's really just having a personal sense then of feeling very content then with where one is, with what one does, and who one is with. And this sense of belonging, especially when we look at it then in the healthcare setting and the healthcare context, really is a two-way street. If we look at healthcare employees then as like one end or one part of a relationship, and we're looking then as the employer or the organization then that the healthcare employee is working for, they are on the other end of that. And what that relationship is really a give and take, but that give and take then doesn't feel like it's simply an obligation, because we felt then in healthcare, especially, radical belonging then is when someone truly is motivated to perform and provide care to the best of one's ability, because they know that their efforts and their care of the patient then is going to be appreciated appropriately. Sure, it is going to ultimately provide patient relief, but what they're doing and what they're able to provide for the patient far outweighs then their efforts, and they know that then the organization that they work for is going to be willing to recognize that. So it's kind of a cycle that we can get ourselves into, where you kind of put into the system then recognizes you, and kind of in turn gives you reap a benefit, so it can continue that positive cycle then moving forward. So when looking at that radical belonging, and what we were ultimately trying to bring back into the healthcare world, this is the definition then that we were using, and is kind of lays the foundation then for all of the elements then going forward as to what we would offer to help kind of fix and alleviate some of that burnout problem then that we are seeing right now in health.
Okay, so COVID definitely had major impacts on marginalized communities across the United States, but also the world. For example, like access to masks, like masks cost money, and not everyone can afford to be having disposable masks that you throw out with each use, or access to safer masks such as N95s when they're going to be in crowded rooms or like with poor circulation and ventilation, and then being in safe working conditions. Not every job allows you to work from home. And so some people have to go to work and they won't be able to take off time due to those conditions. There's also, I know, threats of job loss, like taking off of work. Because like back in the day when COVID first began, you would have to take off 14 days, and not one, even like some jobs threatening job loss, but also like not everyone can afford to have 2 weeks off unpaid work. Also, there was inequitable access to COVID testing. It was very hard to get access to tests. There's also known to be higher rates of morbidity in the BIPOC community. There's just, in general, lack of access to healthcare. in marginalized communities before the COVID pandemic began. And then with the pandemic, people were losing jobs, losing access to insurance, making access to healthcare even worse. And then there's also loss of school programs and after school programs that support at-risk students in marginalized communities due to COVID and school moving online and these programs closing down. Furthermore, there's definitely a digital divide. Not everyone has access to technology that allows them to work or learn from home. And these impacts are all part of the social determinants of health. And social determinants of health are when conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, quality of life, outcomes, and risks. And in those categories include economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. And all of the inequities we had discussed in the previous slide kind of all fall into the ranges of social determinants of health, and where you live and all those things combine to determine your access in general. But when you add a pandemic on top of that, it really began to show these inequities. Young, you're muted.
Sorry about that. So this is a slide going over how to support belonging at Health Fairview, because especially during COVID pandemics, it was there were a lot of episodes where people felt isolated, didn't really feel included, felt misunderstood. And there are three layers to this: organizational, which is kind of a broad spectrum, like a bird's eye view of how to incorporate these ideas, down to team and to individuals. So on an organizational level, we aim to demonstrate healthcare worker appreciation. I think just through social media pushes, either if the hospital or other organizations has a social media account kind of showing appreciations through that. Word of mouth kind of tied in with social media as well, underlying that healthcare workers are also burnt out, as well as what patients could do to help healthcare workers address the burnout, and gifts and acts of service. Maybe small gifts here and there, once a week, just to kind of help with the mental and the emotional stability of just kind of going through this whole COVID pandemic. And increase social awareness regarding vaccinations and COVID precautions. So I kind of hinted at this earlier, the things that patients could do to help address healthcare worker burnout. Because if patients do get vaccinated and do social distance, hand washing, and mask wearing, then it will kind of alleviate just the amount of patients that they have to see for the workers. And as for a team, one of the things that was addressed was this lack of continuity of care, that it was really tough just because people had to take a lot of days off because of being sick of COVID. So kind of establishing a really organized and systematic handoff protocol. If someone has been absent for 14 days in a row, or for whatever reason, really, with poor social conditions and whatnot, so that physician A and physician B both are on the same page of, hey, this is what's happening, with X amount of patients. And then within the individual level, we also want to advocate for mental health. So kind of, if they have certain needs that they have, addressing their needs, right? I thought free therapy sessions would be kind of nice. And kind of for new parents, having a comprehensive maternal and paternal leave for them. And specifically for Black, Indigenous, and people of color, addressing a way for them to have a clear, easy, and accessible anonymous system of reporting healthcare workers, administrators, and patients. Just because during the COVID pandemic, there was definitely an increase in the amount of racism and sexism that people saw during the pandemic, unfortunately. So being able to report that as well and getting that addressed will definitely help with the marginalization idea. So.
So what are the key implementation steps, and how would we place these ideas into short and long-term roadmaps? So for short-term goals, that would consist of working to relieve immediate current stressors on employees, financing the goals of the program, and fostering buy-in from all employees. For long-term goals, that would consist of decreasing burnout and rate at which the providers are leaving their job, improving employee job satisfaction through consistent feedback and change, and creating a culture where employees and leaders can discuss, learn about, and model the recommendations. So how would an interprofessional team support the implementation? Well, everyone first off should believe in the goals and understand how they will affect the team and the patient's well-being. And we could also create incentives for achieving small goals, and just having an interprofessional team can really seamlessly facilitate the communication between different departments and prevent like any fragmentation or miscommunication.
Oh, sorry. What are the metrics for success? So a couple of things that we want to talk about, especially in the light of COVID. We want to decrease healthcare worker burnout. So a way that you can measure that is, you know, are people kind of resigning, right? So if there is a lower incidence of people resigning, people taking days off, then that's a good marker of how we're progressing. Decrease in the amount of medical mistakes during transitions and shifts. So kind of what I talked about earlier, just because people are taking a lot of days off due to COVID, there's a lot of confusion on, what patients are going through, whether physician A, physician B, or just any healthcare worker are on the same page. So having less mistakes, that's important. Less hospitalization specifically due to COVID, right? So that kind of hints at the idea of, is our campaign of kind of addressing vaccinations, social distancing, wearing masks and stuff like that, or are they all kind of being effective? Because if they are, then COVID hospitalizations should ideally be lowered. Decreased stress, marginalization, and kind of sense of aloofness, especially being marginalized communities. I think that kind of gets to the idea of, whether we kind of stand up for these communities, if we do report kind of racism, sexism, or just kind of abuse in general, right? Do we kind of respond to it as well and take action to it, right? And then lastly, increase financial support for healthcare workers who have poor social living conditions. This kind of hints at the idea that, that not a lot of people can take 14 days off unpaid. So it's really hard for a lot of, people. I mean, healthcare workers and just not healthcare workers in general. So I think being able to financially support for them would also be really beneficial as well. So.
All right, next, wanted to touch on ways that our idea is sustainable and scalable to other healthcare settings and organizations. So I think in total as a team, we kind of were under the assumption that like our proposed ideas need to be, there needs to be like a unanimous intention for change. Everybody from all aspects needs to understand that this is a problem, and that as a whole, as a hospital group, we need to take steps to like address that problem so that we can create some change. So in order to do that, we wrote down that we want to make sure that we're having a diversified committee that is dedicated to addressing the problems at hand. So I think that this entails having either a couple individuals that are representative of the entire hospital system and the employees, or having like a whole committee of different people to make sure that there is input from all ends, and that all the recommendations that are lined up can be achieved, and that they will actually be benefiting the people of this hospital system. And in terms of creating a diversified committee, I think having different genders represented, different professions, and then also being inclusive of the BIPOC community, and have them all working towards that radical belonging and decreasing burnout. Additionally, we want there to be a determined common goal as I mentioned, from the input of employees. So if this committee can reach out to everybody in the hospital and kind of just gather like what is most important to them so that their goals are best met with the implementation of the program. Additionally, there needs to be proof that there is intention for change. So there needs to be like actionable items behind what people are saying. Obviously, actions speak louder than words, and just wanting to change things and wanting to increase inclusivity and decrease burnout is not enough to change those things on their own. So I think in order to prove the intention for change, there needs to be some like quick ways to kind of show that the organization as a whole in the hospital system wants to improve the conditions. So whether this means like having a billboard that supports their healthcare workers or providing those free therapy sessions, things of that sort, something that's like quick and can show that like, all right, we're on the trend to try to fix this problem at hand. Additionally, I think the committee should be providing a realistic timeline for implementation of each recommendation to the employees and to the people in the hospital system so that they have something to look forward to and they can recognize that this is a true problem and a true thing that we are working to change because it's not okay to like settle and continue on this downward trend that the hospital system is. Additionally, we want to ensure that every item and recommendation is benefiting majority of employees and kind of just recognizing that this isn't for the benefit of the administration, but it is truly for the benefit of those healthcare providers and the other faculty, or not faculty, facility workers in the hospital. And then another thing that's super important is making sure that this committee or whoever's in charge of this initiative is seeking feedback from people and then readily adapting the program when necessary in order to make sure that everything is like current and relevant and that the goals are adapting with the different changes or problems that come up. And then I know in hospital systems, there can be a lot of turnover in healthcare professionals, whether that be like having students on clinical rotations or residents coming in and out. I think the best way to make sure that the program is sustained is to make sure that everybody completely understands what the essence of the program is, so that when there are individuals that come into the hospital, come in and out of the hospital, they can learn from the other people who are more permanent employees in the hospital, and that it just becomes a new standard and something that everybody is working towards together. And then additionally, just making sure that there's an outlined way for everyone to hold each other accountable, because this committee may not be able to implement all the change and make sure that everybody is working towards it at the same time. But I think as employees and healthcare providers, if we can hold each other accountable to make sure that we're all working towards the same goals, then that would be a great way to prove that this is a sustainable thing and something that a program that we can instill into like multiple different hospital settings.
Okay, so for our reflection, what did we learn about effective communication and case topic from working on this presentation? So in regards to the teams, everyone kind of has their own individualized problem kind of bringing onto their table with the COVID pandemic. You know, for some people, it just might be like actual like work burnout, like they just cannot handle so many patients at this during this time, and it's really hard for them. For other people, it's kind of balancing, you know, they have, you know, they may be divorced and they have all these kids to take care of, but they also have to go to work. For some people, it's financial, and kind of being able to communicate those things, each individual problem, and kind of being honest with it, but at the same time, kind of advocating for yourself is really important. Because if you don't, then that's how burnout kind of comes to be, right? So learning how to advocate for yourself and learning how to make compromises and learning how to kind of see the bigger picture greater than yourself, I think was a really important learning point for me and for our team as well.